Today we're talking about how LDS Hospital is stepping up for mom and babies. And so we've got Nurse Tonya Schaffer here. She is the maternal and newborn and special care nurse manager at LDS Hospital. And it is great to have you here this morning. How are you?
I'm very well. Thank you for the opportunity.
Let's talk about what is stepping up for mom and babies.
Okay, well, stepping up, breastfeeding is really important
So this
to
is
babies.
what it's about,
This is really,
breastfeeding.
exactly. So it's a program designed by the State Health Department of Utah to help give tools for all the hospitals in the state of Utah to really commit to helping breastfeeding for moms. So
I love this. So it started
fabulous.
at LDS Hospital, but you're branching out to help?
It's actually started with the state. They decided there's national programs that also support this, but the state wanted to do something just a little bit different that would be very reasonable, very actionable, very detailed, that they could really support and not have any cost, because that's the other part of it. So it's pretty awesome. There's 10 steps. And with each of these steps, every 2 steps you achieve, you get a star. And so we're working to get 5 stars. That's our ultimate goal. That's where we want to be when we grow up and get really developed in this program. Right now, we're about 2 stars. We got 2 stars. We got our 2.5 because we have completed 5 steps. So we're hoping to get a 3rd star soon. But all of it is just how can we help our moms and babies be committed and really have success with their breastfeeding.
Can we talk about the importance of breastfeeding for just a moment?
Definitely.
I mean, what are the benefits that are so key to our babies?
There are, well, the long-term benefits, we have babies that are healthier because they get all of that great immunization properties that moms are carrying around, all those antibodies and stuff. So that's the very first important thing. There's long-term benefits for decreased breast cancer, decreased ovarian cancer, decreased diabetes, a lot of great bonding with moms and babies. So it really helps cement that whole little relationship. Even just the cuddling is kind of the big part of it, and really helps you feel capable and all of that good stuff.
Is there anything better than just cuddling that little newborn and
There
just
really
connecting?
isn't. That's kind of my best part of my job sometimes.
I want one right here. Oh, just to cuddle so much. So let's talk about that connection that you have. And one of the programs that you have is the rooming in.
Right.
What is that?
So rooming in, the idea is that the more a baby is with a mom and as a little couplet in their little room and a little family dynamic, the better things go. Yeah. It's not really a new process or a new philosophy, but it's really one that's been proven with the research to be very successful. Now, it seems really counterintuitive because you're like, you've just had a mom who's had this horrendous or whatever delivery and it's gone on forever and she's completely exhausted, so why would we want to put everybody together? But it's actually shown that babies and moms really like being around each other, and babies cry less, moms feel more comfortable with what's going on with their babies, they really get the cues of what's going on. Babies have these really early little cues that they start rooting around, they start putting their hands up to their face, all of these things that really parents pick up on really quick, and the nurses and staff, we want to help our families, so we'll sometimes try and take care of the babies and not bring them in quite as soon. So the more that we can keep moms and babies together, the better. It really works better.
So we're looking at the screen right here. These are some of the benefits for the mama, and then we just saw the mama. Now here's what's good for the baby, which you just outlined many of these. The body temperatures. You don't think about that.
Moms are magic that way.
They really are. I mean, this little baby has been with the mommy for 9-10 months. It's really technically
it's just 10 months. It totally
we say 9,
we give credit for 10, definitely.
And they've had them for so long, so they still need that on the outside as well.
Oh, they totally do.
So lots of great benefits. If people want more information about this wonderful program that you've got going at LDS Hospital, where can they get that?
We can go intermountainhealthcare.org. Our LDS Hospital site is definitely linked on there. We have a lot of great information about breastfeeding, rooming in, wonderful videos to help support moms, to help them feel comfortable. We have Nurse Danny. She's amazing. So a lot of great information. We just want our moms and babies to be healthy and successful.
Well, I wish I had you as my nurse for my babies. I had some great nurses, but I think that you would be extraordinary. Tonya, thanks for being here. You just have love written all over your face.